Already a historically expensive drug category, specialty pharmacy prescriptions are very quickly becoming the largest cost driver of both individual healthcare and overall prescription plan management. Compounding the issue, as prices are increasing, prescribing rates are going up as well. So what now? You have concerns, we're here to help. Script Care presents a guide to specialty program excellence. First things first, what exactly are specialty drugs? While accepted classifications vary from source to source, there is typically agreement that all specialty drugs have the following characteristics: medicines that are used to treat chronic complex conditions by a small subset of the population and are, oftentimes, administered via injection or infusion. Additionally, treatments require some form of patient education, extensive monitoring, physician involvement, and special handling and delivery. And most importantly, they are virtually always associated with extremely high costs. Now that we've defined them, let's explore why cost containment is important. From providers to politicians, in newspapers and blog posts, everyone seems to be talking about the cost of specialty. Here's why. The costs of specialty drugs totaled billions in 2015, and these costs are expected to more than double by 2020. And even though they are taken by a very small proportion of the population, specialty drugs make up over a third of annual drug spend. But that's not surprising, since the average annual cost to treat a single condition is over $35,000, and it's not uncommon for annual costs to be more than 3 times that. Industry profits are up as well. In 2015, specialty drugs made up just over 25% of revenue for pharmaceutical manufacturers. By 2020, they will make up nearly 50%. And while the rate of overall drug spend is increasing, 2/3 of that growth can be attributed to the increases in specialty costs and prescribing rates alone. Unfortunately, that growth is expected to continue. Rates of year-over-year cost growth are expected to increase by 17% through 2020, and who knows what could happen after that. The bottom line is, specialty drugs are expensive, and the rapidly rising costs show no signs of slowing down. Development alone tells a story. In 1990, only 10 specialty drugs existed. There were over 300 by 2015, including 32 new arrivals that year alone. The question, however, remains why? We've identified dozens of reasons that at least partially explain the unprecedented growth of specialty costs. 4 of the major and accepted explanations include: advancements in technology and expanding coverage mean more patients have access to high-quality health care, leading to earlier and more frequent diagnoses of conditions treated by specialty medications. Second, with patent expirations, generic drug availability is up, and profits from brand drugs are down. This evaporating revenue stream is enticing manufacturers to enter the specialty market in order to maintain their preferred level of profitability. Third, after the success of government tax and approval incentives associated with orphan drugs, incentives now apply to a broader range that encompasses all promising medications for patients with unmet needs. This, of course, includes specialty medications. Finally, manufacturers are looking at the common chronic conditions historically treated with the now highly available inexpensive generic drugs and are developing advanced $20,000 plus specialty therapy options. Understanding the costs and drivers behind the growth of specialty drugs is only half the battle. You need to take action. But is anyone doing anything to help? We are. As drug prices continue to soar, traditional plan management has to evolve into something beyond price negotiation. Successful cost containment requires a dedicated focus on utilization management and accurate cost reporting. In response, Script Care has developed an industry-leading 3-point solution. starting with advanced clinical support through intensive and consistent clinical interaction with highly trained specialty clinicians. SCL's in-house specialty program addresses member concerns, reduces waste, increases adherence, and eliminates unnecessary costs. Secondly, by assembling a comprehensive clinical profile for every patient, prior approvals are based on accurate data tailored for individual member needs. This increases therapy appropriateness and decreases treatment errors, avoiding unforeseen complications. And finally, SCL offers our clients a copay assistance accumulator, where reported member out-of-pocket expenses are actual member expenses and do not include the assistance provided by manufacturers. Clients can accurately monitor plan expenses, maximize annual copay assistance, and maintain affordable copays for members. SCL's three-point solution balances accessibility with affordability. In short, it saves you money. Do you need a partner who will help you cut specialty costs? We are here to help. We are your specialty expert.